Our next speaker was supposed to be Professor Jane Barlow, Professor of Public Health in early years at Warwick University. She unfortunately has been taken ill, but we're very grateful to have Warwickshire's Director of Public Health, John Linnane, who has stepped into the breach at the last moment, and he will deliver some of Jane's thoughts, I believe. Thank you.
Thank you. Good morning, everybody. My name's John Linnane. I'm Director of Public Health here in Warwickshire. And in the last day or two, Helen came and told me that, unfortunately, Jane Barlow is unwell, and we wish her best wishes for a speedy recovery. And then she said, can you talk? And prior to my career in public health, and I've been in public health for over 20 years, but at one stage during my early medical career, I did work in child health and pediatrics, but that was a long time ago. So thankfully we have Professor Barlow's words, which I am going to read, and I'm asking for your forbearance. But there are some key themes that I know you will all be able to relate to. And the first, I'll press. There we are. Right, the first key point, and in fact the starting point for me for an awful lot of this work and related work is the work of Professor Sir Michael Marmont. And when he produced his seminal work a number of years ago on inequalities, he identified 6 main areas that we could tackle. He reviewed all of the evidence, and this was across all ages. But when he was pressed as to what was key, the key for him was childhood, and particularly the first few years of life. And I think this is reflected very much in why we're here today. A really important point from his work is that if a child is delayed in development, either in terms of intellectual development or emotional development, at that early stage, they continue to fall behind right throughout the rest of their childhood and adolescence. And that's a really important point, because no matter how hard they try to catch up, it becomes more and more difficult to do so. The key time frame is from conception to about age 2, though obviously it doesn't stop then. But those are the key years. And as Councillor Roothouse has already referred to, there is now a growing body of evidence showing that the return on investment for intervention for this work is really good. And as you can see here, what we're talking about during this early period of infancy is trust and attachment, how alert, how aware, and how ambitious or aspirational our children are, but also how we control and regulate our emotions. So it's not just, as I say, the intellectual development, it is right across what we would refer to as daily living. So key to all of this is the parent-child interaction. And of course, we would all know this intuitively, but what Professor Barlow and indeed colleagues have been looking at is the research to underpin that. And we know that the parent-infant interaction is important not just, as I say, because of the intellectual development of the brain, the actual structure of the brain developing, but also because of how it affects our ability to control our emotions. And all of that is laid down in the first few years of life. Right. In terms then of the developing brain, if you bear with me, this is a slide which is a drawing to show the development of the early brain from 1 month up to 15 months. And brain cells are called neurons, and when we are born, we have all of our neurons. So it's complete. However, the baby's brain is not fully developed. And this is mainly in terms of the connections between the brain. And you can see that on this graphic. So while it is a drawing, it's taken from scans and studies of babies' brains. So at birth, the brain is about 25% of its adult weight. By the age 2, this is increased to 75%, and by age 3, it's 90% of its adult's weight. And this increase is not due to, as I said, extra neurons, extra brain cells. It's actually because of the connections that are forming right across the brain. And it's that interconnections which determine how we behave and how we respond to stimulation and how our emotions play out. And I think this illustrates that. So particularly in the first 5 years, our brain is sensitive to stimulation. We know this intuitively, but we also have good examples from life. So, for example, if a child is born with cataracts, which is a rare but does happen, if these aren't removed shortly after birth, that child will never regain fully normal sight. And the same applies to children who are born hard of hearing. And we also know that children who do not have regular contact with other children before and up to age 4 will have underdeveloped social and emotional skills. So this period is key to our development right for the rest of our lives and our functioning right throughout life. So in terms of the impact of the brain, on the brain, as the brain cells are forming, this is stimulated by chemicals, and a really important chemical is cortisol. And this impacts the emotional development of the brain. So we know that if a mother, if a father and the family unit is secure, the levels of cortisol and other chemicals are lower, and babies will develop in a certain way. They respond to that feeling of security. However, if there is stress and tension, which is unresolved or isn't coped with, the baby will also, and toddler will pick up on that. So, and that happens even in pregnancy. So a pregnant mother suffering from stress can pass those messages on to the unborn child, who, because of this higher levels of chemicals, they perceive the world as dangerous or unsafe, and they become effectively more tense. Right. These are scans of two babies' brains, showing activity in the brain. So on your left-hand side, yes, this is a normal brain, and you can see the connections, particularly in the areas marked, but actually right throughout the brain. And it's lighting up, and if we did the same to all of ours, hopefully they would all be lighting up in a similar way, showing because the brain is constantly firing off signals. However, on your right are the scans from a baby who has suffered neglect. And this, we think, is primarily due to high levels of cortisol, which has an effect on the brain to reduce activity, to impede connections, and in fact can actually shrink the brain. So high levels of cortisol blocks positive chemicals and then can lead to the primitive alarm systems in the brain being hardwired as the norm. A neglected child has less ability to calm themselves down because they haven't developed some of the connections necessary to ensure they can manage stressful situations. So, stimulation is a key part of development, but how we cope with that is equally important. And key to that is attachment. So, attachment is important and is slightly different from bonding. A securely attached child, when faced with potentially alarming situations, has learned how to cope with them effectively or to seek help in doing so. So attachment is different from bonding. Bonding refers particularly to the mother and the connection of the mother to the baby. Attachment, though, is about the relationship from the mother, the relationship between the baby, the child, and the parents, mom, dad, and primary caregivers. And that is, if you like, the security around the developing child, and is a really important process, and the timing of this is also key. So, how does attachment develop? So, when a baby is frightened or distressed, they try to attract the attention of the attachment figure, the primary caregiver. The mother, let's say, responds and comforts the baby, satisfies their need. Baby feels safe, secure, and stops crying, and relaxes. And then that allows the baby to, as well as relaxing, to be able to be interested in their surroundings and begin to develop their natural inquisitiveness for the world around them. And key to all of this are sensitive and responsive attachment, and a baby who feels supported in that way develops, as we've seen from the scans, the neurons develop, and they develop the ability to cope with the stresses of life. Right. How am I doing so far? Considering these are Professor Barlow's words, some of which I can understand, most of which I hopefully understand, but I must admit it's been a while since I dealt with some of these concepts. And this is an area where the research is growing and coming to a point now where we and Smart Start are hoping to put into practice many of the findings from research. But it is still a growing area. So in terms of the different attachment styles, secure and non-secure, and they're very much what it says on the tin. A secure baby, as I've just described, has that attachment to the caregivers. They are feeling supported and surrounded with security, and that allows them to explore the world. However, in terms of non-secure attachments, it's when we are ambivalent, when we aren't consistent in our messages to baby, when we don't respond and the child becomes more engaged by objects than people and can often retreat from engagement, and when the other attachment is disorganized. This is when there is no consistent attachment strategy, and there is no imprinting in terms of a consistent way for the child to cope with the situations it finds itself. One of the interesting things I found reading through Professor Barlow's notes was some of the work that's been done in the States on attachment. And there is one study in particular where they followed babies from birth all the way into their 40s. And they found that children who had secure attachment relationships did better, not just emotionally and in terms of behavior, but in terms of their popularity at school, their achievement at school, their exams, and their employment prospects. So these, the concepts we're talking about, the time in a child's life and in family's life, in fact, when that we're talking about, are key to the people of the future here in Warwickshire. So, as I referred to earlier, Marmot talks about from conception to age 2. And in fact, we know that bonding begins in the second trimester of pregnancy. In terms of the impacts on pregnancy, one of the areas that is well now documented are the effects of alcohol and drug taking on the growing child. And in fact, here is a scan of the brain of, on your left, a normal brain at 6 weeks. On your right, a child whose brain has been subjected to repeat high alcohol and drug levels. And there is a growing understanding that it's not just physical trauma, if you like, but a whole range of abuse, neglect, and dysfunctional environments that we can summarize as adverse child experiences, what are called as ACEs. And I remember the first time I heard this, and I thought somebody was talking about playing cards, but it's not anything to do with that, and it is really a way of saying that we need to think right across the spectrum of all of the issues that can impact negatively on a child. And in fact, these experiences have been shown to be associated with the development of a wide range of harmful behaviors. All of the usual: smoking, alcohol use, drug use, risky sexual behavior, violence and crime, so sort of things we would expect. But importantly, they're also linked to higher rates of physical illness, such as diabetes, cancer and cardiovascular disease. So we're not just talking about the effect on the child in terms of functioning in society as a growing adolescent and adult, but also on how their experiences of disease and other conditions as they grow. So we're really lucky that in Coventry and Warwickshire, we have some of the leading researchers in this field. And this report, which was published in March 2015, highlights what works in terms of improving this mother and parent interaction. And this is a key part of what Professor Barlow studies, and the presentation that I'm giving on her behalf. So very briefly, and it will be brief, I'm going to run through some of the findings from her work. And as you can see, key to all of the interventions is that we work with the parent and child. Dyadic simply means two, and that we focus on the family as opposed to the mum or the dad or even the baby, that it must be seen in the context of a family. What the evidence is showing, and the work that Professor Barlow and our colleagues are doing, is that the health and early years workforce, so many of you, need to ensure that they have training in infant mental health and attachment as part of your repertoire. That it's really important that all of that not just parents, but all of the practitioners in this field understand the importance of the parent-infant relationship and are also aware of the services required when problems arise. For me, it's really important that Smart Start is raising the profile of these issues. As I say, we all feel this intuitively, but I think what Smart Start is doing is consistently getting across the messages of how important it is that we value our children and the family unit. So, in terms of how we approach this, we can see that this can be approached in a tiered way. At the bottom, in green, we have essentially a range of universal services which are about increasing awareness, both in terms of parents, but also across the workforce. And then the next stage is the next tier 2, 3, and 4 is very much about recognizing when things are not quite right and ensuring that we have early intervention. So some of the methodologies and approaches that Professor Barlow has been studying, I'm going to run through very briefly. Sensitivity attachment interventions, and these include, particularly at a universal level, awareness and information for parents. Again, this is something that needs more work in terms of evaluation, but it is important that young parents in particular, but all parents, are aware of the issues we're talking about here today. In terms of Tier 2, some of the interventions include the Family Nurse Partnership, which many of you will know about. There are also programs including video feedback, where recordings and coaching of interactions are made, and the evidence around that is really good. An intervention which I quite like simply because of the name, Circle of Security, which is a home-based intervention targeting children at risk of maltreatment. And as I say, there is good evidence for this. The next area are parent training programs. And at a universal level, again, there is increasing evidence that information, awareness, and support is really important for all parents. Moving up the tiers, another program which some of you may know about called Mellow Babies, which is a group-based parenting program, and also Baby Steps, which I know many of you, if not all of you, are familiar with, which seeks to target vulnerable parents. And again, the evidence around these isn't always conclusive, but is emerging and is strengthening. Moving further up the tiers, we get approaches such as mentalization-based approaches, and a study or an approach here is called Minding the Baby, which is used for at-risk first-time mothers, and involves home visiting on a regular basis and is being studied both in America and as well as the UK. And finally, Psychotherapeutic, which are Tier 3, Tier 4 programs, which are about encouraging parents and child to interact in the context of play, and are particularly focused on mums with depressive disorders or infants, toddlers who have experienced trauma or bereavement. And there are a number of different approaches within this context. So, in summary, there is a growing body of evidence, and as I said, we are lucky that much of it is being studied locally, about the benefits of universal and targeted interventions to support mother-infant and father-infant interaction. And that's why we're here today. It's really important that practitioners, nurses, social care staff, all practitioners who are part of the support for that time of life are trained and aware of these different approaches, both in terms of providing universal support, but also of being able to recognize when things are not quite right and intervene early. It's important that these are provided at a local level and that the target is very much the unit, both mum, dad, and child. And I think I would echo the words of the opening speakers. If we don't get this right, you only get one chance. I mean, it's very clear from the early slides that the impact this has on our children. And I think now more than ever, it's important, as times are uncertain, that we do get this right. Thank you very much. And I hope you were able to get a feel for what Professor Barlow would have said to you if she was here. Thank you.